So I thought it would be interesting to look at because if you think about classic epidemiology study, it shows a protective effect of HDL cholesterol levels and cardiovascular outcomes. However, recent studies have kind of put that conventional wisdom under debate. So, for example, clinical trials of niacin as well as the CETP inhibitors have all shown that ability to substantially increase the level of HDL cholesterol levels, but yet the clinical outcomes were not different. So we thought that it would be an interesting project to reappraise the epidemiological relationship between HDL cholesterol levels and outcomes. In particular, I think we wanted to do a couple of things. One is that we wanted to use a big data approach. So rather than having a few thousand people, we wanted to kind of take into the opportunity to look at a large population. So we can look at the entire HDL spectrum. So in the past, if you only have a few hundred to a few thousand, you can only limit it to a certain range. And also we wanted to, in addition to look at cardiovascular outcomes, we wanted to see whether other outcomes are impacted. So in this study, other outcomes we looked at also was cardiovascular mortality, cancer mortality, as well as other non-cancer, as well as non-cardiovascular mortality. So, but I think the main rationale is that we want to really reappraise this given the recent controversies about the clinical trials. So our primary finding was interesting in the fact that we saw a relationship between HDL cholesterol levels with cardiovascular mortality, but as well as cancer and other mortality, really in a similar fashion. Also, the fact that most people have thought about that HDL, if you increase your HDL, your outcomes goes down as a straight line, but we really didn't find it. So we found more a plateau relationship or even a U-shaped relationship, particularly in men, in that if you have low level HDL cholesterol, you have high cardiovascular mortality, high cancer, other mortality, and even at the very high level of HDL cholesterol level, you have high risk of other death. So it's kind of just different findings that what we traditionally believe. Yeah, so I think that what we've believed in the past is that HDL is very specific for the heart, so it's a cardiovascular risk factors. So what we kind of thought that, well, if we find the same relationship in other things, it kind of shows that, well, the similarity between the cardiovascular as well as cancer mortality kind of give it a different spin that, well, maybe it's not, it's more complex than we think. Maybe, it's not as specific to cardiovascular conditions as we think, and that's what we found. And also what we found that is interesting is that, HDL cholesterol is just related to many, many different comorbidities. So for example, you found relationship, in age, women tend to have much higher levels, even many conditions like hypertension, diabetes, as well as many lifestyle factors. So, higher alcohol use have high HDL, and people with just better lifestyles. So, things like fruits and vegetable intake we saw, increased exercise and BMI. So I think it's something that's very complex. It has many correlation with other demographics and socioeconomic and lifestyle factors, as well as its influence. It's not just specific to the cardiovascular system. Really this is the first study in our group, on the big data structures, and it is really very interesting and powerful because, somebody described that, instead of, putting instead of just looking at this afar, you can now, with a lot of patients, you can really put a microscope under this problem. So I think we kind of generated insights that we haven't seen before. So I think we are doing a host of these studies. For example, there's been a lot of really a lot of interesting questions with the cholesterol. So we're looking at relationship of LDL cholesterols, whether we should, how low should we go with these new medications, as well as things like triglycerides. So I think that we're trying to reappraise a lot of the epidemiological findings in a contemporary fashion and contemporary methods. take-home message is that, I think it is unlikely that, increasing, having a medication to increase HDL would really just, substantially to reduce cardiovascular outcomes, given our findings of, that is similar to other conditions. But I think that, just the relationship with HDL is a complex fashion. So I think, things that would improve your HDL, like exercise, better eating habits, it might not just change your cardiovascular conditions. It's probably going to be helpful overall to the person.